When Congress defunded public media, thousands of you stepped up, increasing your monthly gift to help us survive year one without federal funding. We made it, but that loss isn't going away. So if you haven't increased your monthly contribution yet, now's the time. And if you're not a sustaining member, join us. A monthly gift to Boise State Public Radio gives us the steady, reliable support we need for year two and beyond. Choose the support tab at boisestatepublicradio.org.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. If you've stepped outside in the Treasure Valley this week, you've probably noticed it immediately. The sky is not its normal bright summer blue. The foothills have all but disappeared. And that campfire smell, well, it's not coming from your neighbor's backyard. It is wildfire smoke that's drifting into Idaho from large fires burning across our region. It has been more than just a nuisance. The Idaho Department of Environmental Quality has issued air quality advisories, with the Treasure Valley reaching the very unhealthy category. The National Weather Service says these conditions can impact everyone, not just folks with asthma or other lung diseases. And yes, at times over the past few days, the Treasure Valley has had the worst air quality in the entire country, according to multiple air quality trackers and local reporting, as smoke from these wildfires just settles into the valley. So what does breathing this air actually have to do with our bodies? I mean, what should we be concerned about? Well, Dr. David Pate, the former CEO of St. Luke's Health System, as well as the co-author of the book, Preparing for the Next Global Outbreak, is joining us today to talk more about that. Hi, Dr. Pate.
Hi, Gemma.
And folks, remember, if you have a public health question, send us an email, idahomatters@boisestate.edu. Okay, so Dr. Pate, we're hearing these terms, unhealthy, very unhealthy air quality. I mean, at what point should folks be taking this seriously and changing maybe their behavior when it comes to spending a lot of time outside?
Yeah, I think it depends on some specific information. For example, what is the air quality index? The higher that number, the more people that would be affected and need to take action. But also, what are your underlying particular health issues? For example, do you have asthma? Do you have chronic obstructive pulmonary disease? Do you have heart disease? Those people should always be concerned when, even when the air quality index gets not as high as it is now. So to kind of put this in perspective, good air quality would give us an air quality index up to 50, anywhere from 0 to 50. That's good. When it's 51 to 100, it's okay. But when it is over 100, that's when we have to get concerned. For those that are the people that I mentioned, they may not be in great health. They might have underlying lung disease or heart disease. Then in that 101 to 150 range, they need to take extra steps to protect themselves. Where the level is currently is 193, which is the level where, as you indicated in the lead up, everyone should be concerned about the potential health impacts.
Okay, so with that said, Dr. Pate, even if someone has no history, right, of asthma or heart disease, they need to be taking these precautions as well.
Yeah, at this point, the levels are so high that really, even if you're in good health, the air quality can affect you. Even if it's just simply eye irritation and nose irritation. But what we also do is we look at what we call the particulate matter, PM. And so we look to see, is it of a small size or a larger size? And what that makes a difference is when the smaller size, which is the 2.5 compared to the 10, When it's the 2.5 predominating, and that is what is happening today, it is predominantly the PM 2.5. That means it's small enough that not only will that particulate matter when you're outside get down into your lungs, it can actually be absorbed into your blood.
Oh, okay. So, Dr. Pay, there are a lot of folks that can't get out of this. And what I mean by that is the folks who work outside, right? So, what advice do you have for folks like that? Construction crews, landscapers, delivery drivers, farmers, when the air quality is this bad?
Yeah. So, first of all, I would talk to, in my comments right now would be to their employers. You have an obligation to keep your workers safe. I know that, in fact, I was talking to somebody who is in construction last night, and he told me that a number of construction projects they put on hold where people have to be outdoors so that those workers are not working out there. Second, for the workers, you need to protect yourself, especially given that likely if you're working out there, you're a painter, you're a roofer, you're a construction person, framer, whatever it is you're doing that you have to be out there. It likely means you're going to be out there for 8 or more hours. That is a lot. And understand that with every breath you're taking in, you're inhaling this particulate matter. And if you are strenuously working, or perhaps you're just somebody who is outdoors walking, running, walking your dog, whatever, realize that when you are exerting yourself, you significantly increase your respiratory rate, which means that you're going to breathe in even more of this matter. So, what you need to consider is, first of all, can you do whatever you need to do indoors? For a lot of these construction workers, they cannot. For them, they need to really consider wearing a N95 mask, some kind of mask that will have a filtration system in it so that they won't breathe in that material. For people that just really want to get that exercise, well, you may need to go to the mall and do it, or you may need to do something in a gymnasium or inside where you can get that exercise, but not be outdoors breathing this. If you just have to, and especially because you're going to be increasing your heart rate and all, you really should consider a mask to protect you from this particulate matter.
Let's talk about kids, Dr. Pate. I mean, a lot of parents, their little kids play outside. Others of us have, kids in sports, right? I mean, football in particular this time of year. And what should we know about children and how their lungs respond? And I mean, do they respond differently than adults? How concerned should we be about this?
Well, it is a matter of concern, and especially because, as you were just saying, a lot of times those kids are going to be very active. They are likely engaging in sports. And so you have a condition where not only is their respiratory rate going to be increased, so that they are breathing in much more of the particulate matter than, say, if you're the parent just sitting there on the bleachers watching them. And number two, their hearts are working harder. And so they're pumping the blood faster, and they're going to be inhaling this particulate matter. That particulate matter may be able to enter into the bloodstream, and this is going to set up, inflammation. And so, really, we're at levels where I would certainly be imploring coaches not to have outdoor practice. If there's a need for practice, can you do it indoors? What other kinds of mitigations? Maybe it's not the kinds of things that you want to practice out there, but you do something that is less exertion. But really, it's at such a high level that really the children should not be out there for practice at all. And this, unfortunately, what we see is it's going to be a real problem for kids with asthma. If you're a parent of kids with asthma and they just have to be outside for some reason, you're going to want to make sure that you're checking on them, that they're taking their preventative inhalers, that you have a rescue inhaler, and so forth. But for adults, we have to realize that exposure uh, uh, to this kind of particulate matter for extended periods of time results in increased risk for heart attacks and strokes. And pregnant women, a special warning to you. Please protect those babies inside you. Studies have shown that extended exposure to this material, like there are some cities that have poor air quality on a regular basis, can lead to preterm birth, low birth weight, developmental problems. So, certainly, hopefully, we're going to see an end in sight, but you certainly wouldn't want to be getting a lot of exposure day after day if you're pregnant. So please take that in mind as well.
So measles was declared eliminated in the U.S. more than 25 years ago. However, the country has recorded more than 2,300 cases this year. That's the highest number in more than 3 decades. And health experts are warning this virus, it is making a troubling comeback. So, Dr. Pate, how significant is it that we have now surpassed the highest number of measles cases that we've seen in the U.S. in more than 30 years? I mean, what does that tell you?
Well, it's heartbreaking because all of this, of course, is avoidable. If you look at the years since 2000 until just recently, we've demonstrated that we can keep measles under control with vaccination, which can make it so that people can go about their daily lives without having to worry that a pregnant mom is going to get infected, that a newborn or toddler baby is going to get infected before they are of age to be vaccinated, or somebody with that is immunocompromised might get infected. So we have had this protection for a couple of decades. We know we can do it, but now we're just choosing to let that all go. What does that mean? That means that basically, if you look at what's happening today, about 10% of those people that are under 5 that get infected with measles, which is a lot of that number that you just mentioned, they're getting admitted to hospitals. And I for parents that don't know what it's like for a child to be admitted to the hospital, you really don't want to do that if you can avoid it. And second, I think people have just forgotten. They don't fear measles anymore because it's been a non-issue for so long. But now that it's coming back, we are going to have children dying of measles. We're going to have some young adults die of measles, and we're going to have what is the cruelest thing that happens with measles is that there are several things that don't occur until years later after measles. Fortunately, they don't happen commonly, but they do happen. We've got enough people being infected. We're undoubtedly going to see cases. In some cases, it's going to be because of the impact of their immune system over the next few years that a child that seemingly recovers from measles is going to develop a serious different kind of infection and could be threatened with their life. And in the most heartbreaking case, we're going to have somebody that appears to get over the measles, and then 3, 7, 8 years later, all of a sudden comes down with a devastating neurologic disease that would crush any parent to watch their child go through this, that unfortunately is inevitably fatal. And all of this can be avoided.
So, Dr. Pate, can we also talk about the fact that we're seeing childhood vaccination rates across the board slipping? below that 95% level that's quite often talked about amongst health experts. Can you explain again, why is that number so important when it comes to preventing outbreaks like the measles? And we should note, we are getting ready to head back into the new school year here in the next 2 to 3 weeks for most school districts in Idaho.
Yes, well, measles is the most contagious virus that infects humans that we know of, and so the problem is that we have a highly effective vaccine, but the virus is so contagious that unless we get high levels of vaccination across the country, we can't prevent outbreaks of the virus happening. If we can get at least 93 to 95% of people vaccinated across the country, we pretty much won't have we may have isolated cases, but we're not going to have outbreaks like what we're seeing. And so when you think about outbreaks, well, what are those consequences to people? Well, it can be schools shutting down. It can be daycares shutting down. It can be the concern to a teacher or worker at one of those places that might be pregnant, that they could be infected, or that parents who are working who have young children too young to be vaccinated yet. Whereas previously we didn't have to be overly concerned with their exposures, now we've got to worry about if they're going to daycare or they're being taken care of by somebody else, that they're going to be at greater risk. We have to worry about the risks of getting on an airplane. It's a sad state of affairs, but we need the vaccination safe. It is effective, but if people don't get it, we're going to continue to have this disease outbreak like it is.
In our last few minutes, I want to talk about a new study that just came out, Dr. Pate, and it suggests updated cholesterol guidelines. They are updated cholesterol guidelines. What it suggests is that it could make more than 21 million additional Americans eligible for statins. So this is raising some questions about who should consider taking this medication and why. So Dr. Pate, what's driving such a significant change in these guidelines and a push for 21 million more Americans to potentially be taking more medication?
Well, we're learning more and more about the risks for developing cardiovascular disease. We are now from studies, we realize that the onset of coronary artery disease it can be earlier than what was previously thought. And so, one thing that these guidelines would do is lower the age from previously. The target population was those over 40. We're now looking at people, including people are 30. I remember back when I was in training and we were seeing studies of soldiers that died in Vietnam. What we realized is that those young men, you looked at them, they were already starting to form coronary artery disease. So this is a process many years in the making. And what we want to do is use the treatments to lower cholesterol, which is a big factor in this. But we need to do it as what we call primary prevention. That means trying to avoid that first heart attack or that first stroke. So that's one reason is we're now thinking we should lower that age. The other consideration is that we are kind of changing the risk calculation. We can calculate your 10-year risk of developing a heart attack or stroke, and now even look to 30-year risk, and now create a discussion that physicians should have with their patients about how they can modify those risks to decrease the chance of getting a heart attack or a stroke. And we're also considering a greater role for underlying kidney function. Now, I mean, it used to be that if you had HIV, you weren't going to live long enough for this to be an issue. Now, we are able to keep people with HIV alive for nearly normal life period. So we now need to look at the complications and the risk for cardiovascular disease. So all of these factors are causing us to expand the number of people that we think ought to be at least considered for their risks and whether they might benefit from an intervention like this.
And very quickly, Dr. Bate, I have less than a minute left with you. I'm assuming patients should talk to their healthcare providers about all of this if they have any questions.
Oh, absolutely. Your healthcare professional can take the whole constellation of things: your age, your blood pressure, your cholesterol level, whether you're a smoker, whether you have diabetes, your family history. All of these things have to go into the equation in deciding it, and talking to you about things that don't involve medicine that you can do to reduce your risk. So yes, please have that discussion with your physician. We're learning more. I can tell you these guidelines are going to change again. We're learning so much so quickly.
All right. As always, a big thank you to Dr. Pate. And thanks so much for listening to Idaho Matters from Boise State Public Radio. Do you have thoughts about today's episode? Make sure you email us at idahomatters@boisestate.edu or reach out on our socials. And if you haven't yet, could I ask you to leave us a review wherever you listen? We read every single one, and we'd love to hear from you.
Each story you hear on Planet Money starts with a question. What happens if we refund tariffs? Why are groceries so expensive? At NPR, we stand for your right to be curious because the forces shaping our world can be hard to see. Follow NPR's Planet Money wherever you get your podcasts and start seeing how the economy really works.